I think we need to talk about something that is very, very rarely discussed after spinal surgery and also after nerve compression, and that is the fact that it wasn't just traumatic to the peripheral nerve, but to the whole nervous system. Trauma to the nervous system can cause an overreactive stress response, feelings of being on edge, panic sensations, and emotional instability. And what it means is that your brain can go into a protection mode. According to the Mayo Clinic, nerve injury and pain can directly affect mood and anxiety levels. So while our nerves are healing, it can also get their signaling wrong, and it sends very confusing signals to the brain. These signals can cause tingling, burning, electrical sensation, and sudden pain. Your brain then interprets these signals as danger, and it can trigger anxiety. We all have these questions. Suddenly I have a pain, and then a lot of questions goes through my mind. Will I fully recover? Will the pain go away? Will I walk normally again? Have I hurt myself again? Is this why the pain is back again? These can cause uncertainty, and that triggers anxiety. This is a very normal response to injury. And according to research, this is also very common after spinal surgery. Pain and anxiety shares the same system, and it causes the same thing: an increase of adrenaline, an increase in heart rate, an increase in muscle tension, and changes in breathing. This creates a negative cycle. So I have pain, and then it triggers anxiety. Anxiety triggers muscle tension, which in effect increase my pain and thereby my anxiety. We also have to include the fact that some medication can also increase our anxiety, like strong painkillers, steroids, or some of the nerve medication. Another thing is poor sleep, and a lot of patients will tell you that after surgery their whole sleep pattern has been disturbed. This causes anxiety, a feeling of panic, and emotional sensitivity. So it is extremely important that after your surgery, by the time that you get home, that we try and establish our normal sleeping pattern as quickly as possible. The good news is, as the nerve recovers, so does all the rest. So most people will find between 6 to 12 weeks that there's a noticeable improvement. By 3 to 6 months, major improvement, and by the end of the first year, the whole nervous system has fully calmed down. But what can I do when I'm this anxious? What can I do to decrease my anxiety? Well, walking, slow, deep breaths, really try and get a good night's sleep. Physiotherapy, talking about your fears or writing them down if there's not somebody to talk to, or if you are too scared to discuss them. Journaling has been proven to really help with anxiety. A gratitude journal. Our brain cannot really do two things at the same time, so it cannot be anxious and look for answers. So if I ask myself, what am I grateful for today? I'm pushing the brain into looking for answers and thereby decrease my anxiety.